My name is Dr. Kurt Belk, and I'm a board-certified emergency physician and the medical director of the Urgency Room. I want to thank you for choosing us as your healthcare provider. The following video offers follow-up care instructions to your recent visit.
I'm Dr. Carolyn McLean, a board-certified emergency room physician. You visited the urgency room today because you experienced bleeding during your early pregnancy. Early pregnancy is considered the first 6 weeks after conception. Bleeding in early pregnancy can be a sign of a miscarriage or an abnormal pregnancy, but spotting isn't always a cause for concern. Often the pregnancy will continue normally with no problems at all. During the examination, your urgency room healthcare provider may have asked for a blood pregnancy test and an ultrasound to try to determine the cause of the bleeding. Sometimes your doctor can't tell what the problem is right away and will need to watch you over time. You may need more blood tests and another ultrasound. If your healthcare provider was not able to see a pregnancy, it may be that everything is normal and it's just too early to see the pregnancy. However, early bleeding could also mean you have an ectopic pregnancy, which is a pregnancy in an abnormal location, such as in the fallopian tube. An ectopic pregnancy can cause severe internal bleeding or even death, so it's critical that you be seen by your regular doctor or an OB/GYN doctor within 48 to 72 hours for a repeat blood pregnancy test. Until you know more information, you shouldn't be alone in case you suddenly become very sick. Avoid sex and don't put anything in your vagina until you've consulted with your doctor. If a pregnancy was seen in your uterus, you need to see your regular doctor or an OB/GYN doctor within 2 to 3 days. Avoid sex or putting anything in your vagina until you know more. If your healthcare provider was able to see a heartbeat on your ultrasound, the chance of a miscarriage is much lower. We hope you don't have a miscarriage, but if you do, here are some important things to know. Early miscarriage within the first 6 weeks of pregnancy is very common, and one miscarriage doesn't mean you will have problems with another pregnancy. Nothing you did caused it. Many women beat themselves up because they think they did something wrong. Taking medicine, drinking alcohol, having sex, exercising, or falling down won't cause a miscarriage. Once you return home, watch for symptoms and come to the urgency room right away if you have severe abdominal or pelvic pain, you faint or feel lightheaded or dizzy, you have a fever of 100.5 degrees or higher, your bleeding gets much worse and is heavier than a heavy period, or if you pass any blood clots larger than a quarter. You pass any tissue, which is solid material that doesn't appear smooth and even like a blood clot. If you do pass tissue, save it, even if you have to pull it out of the toilet and put it in a plastic bag or jar and bring it in. We understand how scary it can be to experience bleeding during your early pregnancy. If you're worried about your baby's health or your own and have trouble getting in to see your regular physician or OB/GYN doctor, visit the urgency room for immediate care.
These videos are intended to provide helpful health information to the general public. They are not intended to be a substitute for professional medical advice. You should not use this information to diagnose or treat health problems, and you should not use these videos in place of a call or visit to a medical professional. Talk with your physician about the proper treatment for your particular condition, and always follow your physician's advice. If you think you need an ambulance or are experiencing a medical emergency, please dial 911 immediately.